Hi, welcome back to your prescription for medication education. My name is Yenmi, and I'm here to bring you quality information regarding medications and health-related topics, and in the process, expand my own knowledge. Today, I'll be continuing on video number 3 of my hypertension topic, so let's go ahead and begin. I've decided to start out the video with the questions at the beginning versus the end, hoping that this will enhance the learning process and hopefully keep my viewers engaged all the way to the end. These questions are generated by ChatGPT, but they are based off of the information that I provide during the topic. So let me go ahead and start off with question number 1. A network meta-analysis comparing 22 lifestyle interventions for blood pressure reduction found which strategy to be the most effective overall? Patient with newly diagnosed stage 1 hypertension loses 8 kilograms over 6 months. Based on available evidence, what blood pressure reduction would most reasonably be expected from weight loss alone? Question number 3. Which population generally demonstrates greater blood pressure reductions with the DASH diet? Question number 4. Why are OTC potassium supplements in the US generally ineffective for blood pressure lowering? Last question, question number 5. Which regimen aligns with evidence-based blood pressure and lowering targets? So I'll go ahead and go through the rest of the video, and at the end, I'll go ahead and provide the answers to these questions. Lifestyle modifications play an important role in delaying or even preventing the occurrence of hypertension. Based on a network meta-analysis comparing the effectiveness of 22 lifestyle strategies to reduce blood pressure, the most effective intervention was the incorporation of the DASH eating plan. Other strategies include aerobic exercise, resistance training, adjusting sodium and potassium intake, and stress reduction strategies like meditation. As discussed in my obesity videos, weight loss improves health and reduces the risk for a myriad of health conditions, including hypertension. A weight loss of 1 kilogram generally translates to a reduction of blood pressure of about 1 millimeter for both systolic and diastolic. Weight loss also increases the blood lowering effect of other lifestyle changes. DASH stands for Dietary Approaches to Stop Hypertension. This diet plan emphasizes fruits, vegetables, whole grains, low-fat dairy, lean proteins, while limiting saturated fat, cholesterol, refined sugars, and red meat. Blood pressure reductions with the DASH diet vary by study, but we can see systolic blood pressure decreases somewhere between 1 to 13 millimeters of mercury, and diastolic blood pressure decreases of 1 to 10 millimeters of mercury. In Black individuals, the blood pressure reduction is generally greater with the DASH diet. This mechanism why this occurs is multifactorial, but Black individuals demonstrate greater salt sensitivity, which is a physiological trait in which blood pressure responds more dramatically to changes in sodium. There are several cookbooks available for patients to purchase that follow the DASH diet. Reducing dietary sodium intake lowers blood pressure and reduces cardiovascular events and mortality. Reducing sodium intake from over 4,500 milligrams per day to somewhere between 1,500 to 2,300 milligrams per day produces mean blood pressure reductions of about 3 millimeters for systolic and 2 millimeters for diastolic in normal intensive individuals, and for patients who have hypertension, a reduction of about 7 millimeters for systolic and 3 millimeters of mercury for diastolic readings. In the US, the majority of sodium consumption is due to processed foods and meals prepared by restaurants. Potassium-rich salt substitutes used in place of regular table salt can approximately reduce systolic and diastolic blood pressures by about 5 millimeters for systolic readings and 1.5 for diastolic readings, depending on the amount of sodium replacement. In the largest cluster randomized trial to date, over 20,000 adults in China with uncontrolled hypertension were randomized to a salt substitute containing potassium chloride versus regular salt. The intervention lowered systolic blood pressure by 3.3 millimeters and produced 12 to 14% relative reductions in stroke, major cardiovascular events, and all-cause mortality without increasing hyperkalemia. Potassium supplementation via salt substitutes should be avoided in patients with a history of advanced CKD, hyperkalemia, or all medications that reduce potassium excretion. Moderate potassium supplementation on average lowers blood pressure by 6 millimeters for systolic and 4 millimeters for diastolic readings, depending on the dose of potassium, the patient's sodium intake, history of hypertension, and the use of antihypertensive medications. There seems to be a U-shaped relationship between potassium supplementation and blood pressure levels. Doses of 30 millimoles per day seem to yield the highest reduction in blood pressure, while doses above 80 millimoles per day increase blood pressure. As a side note, over-the-counter potassium supplements in the US are regulated to contain no more than 99 milligrams of elemental potassium per tablet, which is approximately 2.5 millimoles. This limit is in place due to safety concerns such as hyperkalemia and gastrointestinal ulceration. This limit on OTC potassium makes it impractical to achieve the recommended potassium levels recommended. This is why the guidelines recommend that potassium should come from dietary intake. The DASH diet provides about 120 millimoles per day of potassium through whole foods like fruit, vegetables, and low-fat dairy, which is more than enough to meet these recommendations alone. Exercise programs involving aerobic exercise, dynamic resistance, and static resistance training lowers blood pressure quite well in both normotensive and hypertensive individuals. Even patients who live a sedentary lifestyle or have certain physical limitations can still benefit from lower intensity physical activity, such as walking. Aerobic exercise decreases systolic blood pressures by about 4 to 7 millimeters and diastolic blood pressure readings by about 3 to 4 millimeters, with larger effects in patients who are actually hypertensive. Each additional 30 minutes per week of aerobic exercise correlates to an average reduction of blood pressure by about 2 millimeters for systolic readings and 1 millimeter for diastolic readings, with the largest reduction occurring when patients engage in a total of 150 minutes per week of exercise. Dynamic resistance training alone also reduces blood pressure, but to a lesser extent than aerobic exercise. Isometric exercises may have the largest blood pressure reduction in trials, but evidence is limited. Combining both aerobic and resistance training together doesn't add any additional blood pressure lowering compared to either one by itself, but still works just as well. The ACC-AHA guidelines state all types of structured exercise appear to be safe even for older adults with hypertension. Personally, I enjoy dynamic resistance training. I would recommend letting the patient decide what they enjoy and can honestly commit to. Patients should work their way up to the following evidence-based goals: 90 to 150 minutes per week of aerobic exercise, or dynamic resistance, also at 90 to 150 minutes per week, or 4 sets of isometric resistance training, 2-minute exercises at 30 to 40% the maximum voluntary contraction, with 1 minute rest between exercises, performed 3 sessions per week. There seems to be some evidence from clinical trials that have shown that transcendental meditation can lower blood pressure in both normotensive and hypertensive individuals, with mean reductions of about 5 millimeters for systolic readings and 2 millimeters for diastolic readings. I'll briefly explain what transcendental meditation is because I had to look it up. It's a meditation technique where you mentally repeat a word or phrase until you reach a state of inner peace. You should be trained on how to do it properly by a professional. Transcendental meditation typically involves 20-minute sessions performed 2 times a day. Okay, so the answers to the questions I presented at the beginning of the video are: question number 1, it was the DASH eating plan. Question number 2, the answer was 8 millimeters for systolic and 4 millimeters for diastolic. Question number 3, the answer was Black individuals. Question number 4, it was a maximum of 99 milligrams per elemental potassium per tablet. And question number 5, 90 to 150 minutes per week of aerobic or dynamic resistance training. And that was your dose for medication education. I do hope you enjoyed today's video. If you did, please consider subscribing and sharing my channel. Also, if you have any suggestions or ideas that I can use to incorporate into my videos to make them better, please feel free to chime in. I'm open to any suggestions. With that being said, thank you and have a great day.